born and bred in Coen. It's just a nice little place to be. Everybody knows each other. My father's always lived in Coen. My mum married in and came here when she was 24 and became the local nurse. We grew up with her telling us how wonderful the sound of the RFDS engines were. So that was the lifeline for her as a nurse. The last formal evacuation that my mum did was actually my dad. He had suffered burns to 30% of his body and Mum was the nurse on duty. That was a Category 1 call, so plane takes off immediately. Wonderful feeling to know it's on its way. I just can't rave about the RFDS enough. It's a reality. I know it seems like it's been bred into us, but they are phenomenal. The doctors and the nursing staff that we see are inspirational.
What I like about working in Coen is having Jodi here. I've worked in a number of remote areas around Australia and it doesn't matter how good the medical staff are, unless you have someone running the clinic properly, your work can be very difficult. She's part of the community, so people loved and respected her mother and they also have the same love and respect for Jodi. She has done an amazing amount of work already on looking at providing a home palliative care service in Coen. She cared for her mother, Barb, when she passed away, and she has seen many other people in town who haven't had that same privilege. For a lot of local people, if they are at end stage of their life, they have to be flown down to Cairns, admitted to the hospital, and they die often alone in the hospital.
My mum's battle was with cancer. So whilst treatment and such was all in Cairns, our local flying doctor GP was her main point of contact. A friend of the family who was a nurse and had grown up in Coen came back to be able to nurse Mum to the end. And that was amazing for us, the support that she could offer. Mum passed just before Christmas and we actually spent the next couple of months after that talking with community about palliative care. That was based around what the community would like to see happen. So a lot of Coen remember this building as our health clinic, and the idea would be that we could turn that building into an area that allowed for people to come home and pass away surrounded by family. You can make a difference as just one person. Yeah, you definitely can. And it doesn't have to be a big difference, but it can be a big difference to somebody.